Thank you both very much. This is like the dream team of elected officials if you've tried to do this work anywhere. So I want to start out, just ask a couple questions and open it up to my colleagues for questions. If you folks could step back from all this success and put yourselves in the position of you had this realization about sort of the broader determinants of health. Can you talk a little bit about sort of where that insight, you've sort of been through the training, so you sort of talked about it, but especially how do you communicate that? Because I think one of the real issues, especially in the United States, and for a lot of people trying to look at this issue of health is not just health care, but the power structure, the funding, et cetera, the politics, the political interest, and public interest very often is in the personal health care system. So how did you start talking about that in a way that worked to your colleagues, to people in power, to the public? Can you just reflect on that a little? It's probably a real throwback for both of you, but I think that's probably a really important question for us at this point.
Thank you for the easy question right off the bat. I have to say, of course, when we make a presentation, we only show the good side of things, and it's always a challenge, and we always have fallbacks. And what I think, I've come up with this acronym that to push for change in policy, you need EDA, which is evidence-based, data-driven, and action-oriented. And I think we, coming from the academic field, evidence is our bread and butter, and butter, and data, we are getting there. Especially before data. We don't have as much after data as we should, but we're not oriented to action. And what does that mean? Well, it means that if we want to promote any kind of change, we need to raise awareness. It's because if we're defending something that is not in line with public concern, it will not happen. We will not convince the political leaders to go into that direction. And that takes a lot of work. And when we talk about, the moment I say health, in the parliament or anywhere, people turn on, the switch. Okay, this is a social policy thing, and the major transformation that needs to happen, and it's a continuous process. We haven't got there yet, not even in my city. Is how do I make sure that people look at health as more than just a social policy issue, but especially as an economic tool to drive social justice and inclusive wealth and growth. And that is something that we are far from. But I think we have to continuously show that and have that in our speeches, which means we have to redesign the way we create the incentives models so that within the financials, people understand that it makes sense. They have something to gain from it. That leads to the budgetary issue. And so presenting ideas that are tremendously expensive have very poor chances of success. And so redesigning them so they can actually save money, and not just 30 years from now, but early on, or even cost less at the beginning. How do we redesign our ideas to do that? Or where do we get the money? I think it's very important to be concrete. It's not just defending what the evidence says. It's saying how, in practical terms, do you translate that within the real system, the real world complexity that Charlotte showed us so well. And then making sure that we're collecting that real-world data afterwards so we can adjust as we move along. And lastly, it has to be timely. In the previous session, they were talking about political cycles. And it's absolutely true. If we are not capable of showing results within one political cycle, we will not be able to push for whatever we are pushing for. And that leads us then, but there are certain things. You were talking about climate change. How do we convince people of something that will probably only happen 30 or 50 years from now? And that has been a topic of serious reflection on our side. And we, people working in evidence need to break down the outcomes on those 4-year cycles. Even if we're looking 40 years down the line, it means that to get to those 40 years, you have 4-year cycles. And what kind of outcomes are we supposed to have throughout those 4-year cycles to make sure that we're on path? Or else it's just, a leap of faith. And I think we've gone past that at this point. And the other thing is using data actually to generate tools. In the field of hepatitis C, where I've worked tremendously coming from the infectious diseases field, we developed an app called Let's End Hep C at my university. And basically what it is, it was designed because nobody's going to read the treaties and articles and thousands of reports out there. How do I have an app that in 30 seconds or 60 seconds I can convince the Minister of Health of changing his position? And this app has actually transformed the Romanian action plan for hepatitis C 2 weeks ago. And after we did the mathematical modeling, after they changed it, based on current policies, they will achieve elimination by 2029, which is incredible for a country like Romania. But what the app does basically is it looks at what are the policies needed to achieve elimination, so that's the main outcome. Looking at the different policies, different levels of implementation, making sure that each country can compare themselves with each other, so you peer pressure in a way. And then it calculates through mathematical modeling the different health outcomes, including if you're going to achieve elimination by 2030 or not, in the app. And then it allows something which we call the policy calculator. So we've gamified policy making in the way that people go on the app and they can actually change the policies. And I told the Minister of Health, download the app, we're not looking, change the policies freely, and see what are the different outcomes you can get. And doing this, you're condensing thousands of articles and reports and millions of bytes of information into something that in 60 seconds, someone can see the results, they can show the results. And as a politician, they can say, these are the outcomes we're going to have 10 years from now. And this is because of the decision we're making today. And so I think implementing these different tools will possibly help us to move in the direction of making sure that these different determinants are involved in policymaking, or so we hope.
Yeah, I agree with all what you said. I'll add that, for instance, sport, we tried to do things, it didn't work. We have a big issue in France now is alcohol policy. And as a health person, you're not the funny one. You're boring one. Oh, with you cannot smoke, you cannot drink, you can, So you have to make it more funny. This is health girl. You have to make it more attractive. And with tobacco, we finally changed things in France. Alcohol, our agriculture minister said that wine is not an alcohol like others, And so we have big issues on that. And I'm not serving alcohol in any of the official reception in the city if you come. They think I'm boring. And they think I'm not funny. And I'm always saying I was not elected to be funny. The thing is that it's the second cause of mortality in France, of premature mortality, is alcohol. It's huge. It's almost 60,000 people dying. It's 6,000 euro of social cost every year per person. Each inhabitant pays 60,000. So economic incentive is not enough to change some politicians because the lobby are stronger. So this is sometimes we can do a lot, but we can do that. Sometimes we don't have the efficiency to change things because the cultural approach. But I can work on the living skills of the kids. There I can do something. I can work with the students. I can work on risk reduction. I've got 70,000 students in the city, and the region is known for its drinking and parties. And risk reduction strategy worked. We actually had success on that. We stopped saying alcohol is bad because it doesn't work. But we said, if you drink alcohol, you want to drink a lot of water also. And we raised from very bad situation when we had ethylic comas every Thursday night, because it's Thursday night, it's a party night, on having no more emergencies like we used to have, because we taught people how not to binge drink, how to take care of themselves. We put peer-to-peer action on the street during the night, and that changed things. So it's really local actions that make us think. But sometimes we have to admit that we have to use windows of opportunities. And if the door is closed, we go through the window, we find another way. But and I think it's really the health sector, it's really about not staying in our place. And last but not least, but for the air pollution, for instance, if I improve the air pollution in my city for the quality of life of the people, I don't earn any money. The money goes to national government, not to the city. But we clean the buildings, and air pollution is costing a lot of money on the building that we have to clean. And this is money for the city. So we framed it on the money of the city, because otherwise it's not our money. So we have also to be very specific.
Okay, just second question, because I know this is one that everybody as we've been talking about, we've been hearing the last day or so, really good, interesting examples of companies sort of partnering with political leadership to really make initiatives to prevent disease and illness and sort of address community conditions. And then we know as you pointed out, there are also companies lobbying against the changes that would promote health. And again, I'd like to ask you just to talk about what works or doesn't. I mean, what are your sort of success experiences or failure experiences working with the private sector in your own experience as elected officials? What do you want these folks to do better and to really be helpful to you? Because I think everybody here wouldn't be around this table if we didn't want to understand better how to bring these partnerships together and make them work. So maybe each of you could comment on that briefly, and then we'll invite our other colleagues back.
It is clear that if we are going to move in the direction of the health reform that I tried to very briefly overview at the beginning of my presentation, it is impossible for us to do it alone as a public sector. And that being said, it is very clear also that the private sector in this space has much more data many times than the public sector does, tremendous resources and knowledge, and a global view. So an understanding of also best practices and of what works and what doesn't. And so I think that it is extremely important. And we're starting to see corporations move in this direction of understanding that there is a need to present proposals and ideas in a way that they're not just, pushing for a pill or pushing for some kind of technology, but they present it in a format that fits into, it's like the missing piece in a puzzle of the system, and connects to the different parts around that missing piece. So understanding that they have to present it in a systemic way. So providing not just a technology or a product, but providing a solution. And I think that's a major transformation. This being said, the corporations need to find governments as a counterpart, or in this case also cities, that are willing to have that conversation. Mm-hmm. And, back in Europe, there's a lot of ideological prejudice. And, if I say PPP, they're probably already kicking my back somewhere. And so it's especially in my country, where we have 20% of communists and Trotsky parties. So it's an ideological issue that needs to be overcome. But people need to see practical examples of how these kind of collaborations can translate for themselves, going back to hepatitis C as my example. So Portugal was the first country in the world, hepatitis C was a big thing with the pricing issue of drugs. And Portugal was the first country in the world to negotiate universal access to treatment, despite being in the middle of an IMF financial bailout. And being able to do that, not paying per pill or per cycle of treatment, but there was a negotiation so that Portugal would only pay after the patient was clinically cured, and we would only pay per cure. And so the financial incentive was actually there, showing that we are paying when people are actually getting the outcome that is promised. And I think that that is a very concrete example of how that is possible. At the local city level, for example, Cascais is part of a movement called Fast Track Cities, which is a movement to end HIV/AIDS. We've expanded it to also viral hepatitis and tuberculosis. And private corporations are actively they're at the table and helping funding and designing the early diagnosis, so the testing, the screening, because of course it is in their commercial interest, but it is in the interest of the city that wants to end these epidemics. And so it's finding those common grounds, I think, is extremely important, and making sure that we present solutions that people can understand that translate to ensuring their own well-being and making their lives a bit better.
So you say, we are politicians. Anybody is kicking our back anytime, whatever we do. So that's being said. For instance, what we need from private company is an understanding more about equity and uses, from my point of view. Because sometimes solutions are not fit to the users. And sometimes they give solution that meets with the user of the better neighborhood, which for those, I don't have to do anything. They don't need me. They don't need government lots of the time. They need places to park and water, but apart from that, they don't need me that much. So we need innovation that's actually getting everybody in the room. Digital technology let us have, for instance, translation in many languages when we have different communities. I've got lots of communities in my city. If I could have something, an app that help people to go walking to school, you know, that they have some that you can share with the people, the fellow in your school, but they're individual and they're for people literate. If I could have one, you know, a big one in the city that you can translate in several languages and really easy to use, that could help the communities to get and be part of the community, this would be a great use, and I could pay for that. I could find the money. Really, I'm able for everything that's innovation. We can find money, and that would actually fit the needs. Same for housing. We work a lot in housing. We are a city where we have a very strong housing policy, and we're renovating the neighborhood. We have an issue when you renovate the building for the 60s and you isolate them from outside. Yes, you've got better energy outcome, but you've got noise. The people living there, they're getting mad. They're getting sick physically and mentally because you can hear your neighbor snore. And the architect and the planners, they don't know that. And the private company making that because I don't live there. And so we're trying to find deals. We're trying to get several cities together to have new phonic norms. But with one of the builder, we just arrived to a compromise that they will put the living rooms together and the bedrooms outside. So we are fixing things by getting together. They do that because I'm working a lot with mental health issue with them because, of course, it's the cheapest neighborhood. So we have lots of people with mental health issue, and we are actors in that. We help them. So it's win-win strategy. And then they listen to me when I'm telling them, well, what you're doing is terrible because people are going to be sick out of the noise. So it's always how do you frame it? So you give something and they get something you back. But the strength of the community, of the mayors, is that we know what community, well, ideally, we know what communities are going. So we can give an entry point to the private sector, to what community is doing. We can give tools to work with community because it's not that easy, right? It's not always easy, especially as private sector, but also as public sector, to go and work in the neighborhood. We know how to do that. We have champions. We have leaders. So this is really where we can do things. Food is another thing. Water, I mean, and bicycle, of course. If you don't have a real understanding of the obstacle for the change of behavior, you think, like, oh, you tell the people that do something. So we really want tools that are adapted to our needs. And I think that's the basis of the partnership.
Let me invite Clarion and Anne and Nils back up here, and I'm going to move over here. Just to open it up for questions, we have about the last 10 or 15 minutes. I want to give everybody a chance. Go at it. Okay, Robert, start with forum members, and then we'll have the audience.
Yeah, thank you very much. It's been a very exciting morning and great presentations. I think most of us in the room are very comfortable working at the national level and maybe even in some big countries at the state level. But when we're working in urban health, we're dealing with municipalities. And it's different. There are different dynamics. And I was just wondering if you could share with us your perspective of the difference, and then how we could better work with municipalities versus the previous kind of relationships that we tend to have with the national and the state levels. Thanks.
Well, the big difference between local and national, and now I'm at national, and I've been at the multiple levels, is that at local level you actually get something done. And I think that's it translates into people's lives in a much more direct way. And also when you don't get it done, they knock at your door. And so that is something that, is very, very impactful, and I think it can be a motivator to actually find those new ways of finding solutions. And as Shelley was saying, sometimes, the financials cannot be there, and so there might be a need to find the funding to get something done. That's where the private sector can potentially step in and find those win-wins and get it out there in terms of something that can translate into something that people can understand. And I think that is very different than the national. We don't have the state experience back home, but then at the national level, it's not as clear, the connection of what you do in terms of partnerships and how it translates. But I think it's very important that the way it is promoted by the city, and it is important to ensure that you have the full engagement of the mayor or the councillor responsible for that area. And if possible, getting those different key those key partners in the city that are involved. From my experience, and I've noticed sometimes some, especially multinationals that step into a city and want to do something, they don't do the mapping out first, understanding the local culture, the local reality, and who are those key players. Mm-hmm. Because if you get those on board before you have that first key meeting with the mayor, it's a secret to your success in a way. Because that environment somehow influences the way you're going to achieve your outcome.
Agree with all that. I just add, use the networks, use the champions. We have so many mayors all over the world, mayors, health mayors that are champions and that can help you get into it. We have networks for that, whether it's WHO, LCCT, or other networks. And we have to connect all the dots, and because those people can get you there. And that's also, and if one city has done it, 2 cities have done it, you're like, oh, and you can talk to a peer and say, oh, did you betray yourself and did you sell your soul to this company? No. Okay, maybe I can think about it. We need this kind of peer-to-peer because we need to know, and using champions is really something that can help the partnerships in the cities.
Anne, quick comment, and then Niels and Anne, and then we'll go for another question.
Yeah, I just wanted to say that this was really music to my ears, because that's exactly the condition sine qua non for us to engage in a city, is to have that full landscape of who are the stakeholders. We have to have around the table to co-design the whole intervention and to co-define what is our outcome we are going to measure. Because I very much liked your talk about how important the measurement is, and how expensive that is. That is the main part of our investment currently. Even if we are not going to expand to other cities, we will really want to measure for 2 more years whether that success has been maintained. We measured the health outcomes, the soft ones and the hard ones. And it was a question to you, if I may add it, does it take also in your country such a mindset shift for the local authorities then to use those data, those real-time data, and apply them in their decision-making? Because that's what we were facing and are still facing. Really, the shift you need to use these scary results that are very different from what was taught, and then to act upon it.
So when we started 5 years ago, I think we lived in a world where public-private partnerships were very transactional. You'd have a city, we need cleaning in our schools, we contract with a company, they'll clean it, we pay for it. That's kind of the contracts we were meeting, and so then when we came in and say we would like to work with you to understand risk and vulnerability around diabetes better, we don't expect to get paid. How do you? It was a very simple challenge of how do you write a contract or a memorandum of understanding of that. So we've involved that, but it has made me think that there is possibly a taxonomy of partnerships here. They're the transactional ones, they're kind of the shared value ones, and then and I think we're moving into that, and with the help of the Sustainable Development Goals, the purpose-driven ones, where companies, foundations, civil society organizations join together with municipalities, with states, and so on, for the purpose of solving societal challenges. And then, we add what we can, and some will come with investments, and some will come with skills, knowledge, data, and whatever. But it's the purpose that is important, not necessarily the transaction between 2 separate parties here. And I think this is what I really think is interesting, because that's where I think there's a lot of movement, and also, a lot of opportunities to really make some big mistakes.
Ricardo, do you want to speak to the data use question that Anne asked, and then I want to have another question from the group?
Sure, very quickly. Thank you, Anne. I think if I understood correctly, you're asking me if my city uses data to prefer policy, and I have to say yes. That's the official answer. But beyond that, I'd say that we have been most successful when we are capable of creating tools, and I think the Qashqai's 2030 project on the SDGs showed that, when we were capable of translating that data into a way that people can feel it, and the people have tools to transmit their feelings publicly. And so, having that data, but not understanding how it truly impacts, because sometimes we have a lot of data, it doesn't really translate into the well-being of the people. And sometimes it means we're collecting poor data, or we're collecting it poorly. And so there can be, or translating it poorly. And so there are multiple issues. It's extremely important. It's that, especially at the local level, making sure that the reactions, the way it impacts people's lives, is critical. And we've created systems where people can, with their phone, basically take pictures of situations that they feel are not working, and using georeferencing, it's sent up to the city. And those kind of tools sometimes are even more impactful because it's translating something that people are translating themselves. And we have what we call neighborhood leaders, that everyone in that neighborhood knows who it is, and they have a phone given by the city, and there are direct connection at that very, very local, almost street level, and we can convey them whenever we want to collect that feedback. And that feedback kind of system is extremely important. And I'd just like to pick up on what Niels was saying, because I think that this transformation fuels into what I was mentioning before in terms of going from that pay-for-project kind of approach to actually the private sector stepping into to partner truly towards building sustainable solutions, aiming for the future. And I think that's what Charlotte was saying is so important also on the peer-to-peer. At the national level, I founded a network called Unite, which is a global network of parliamentarians. And what we've seen, and it's mostly focused on global health and infectious disease, but what we've seen is that when we get that peer-to-peer interaction, people listen. And it's the same at the city level. Mm-hmm. That kind of peer-to-peer interaction sometimes is the small but important effect to actually move from inertia to action.
Yeah. Very quickly, because I want to get my colleagues a chance to ask.
It's not normal that all cities or this voluntary city we are developing and putting lots of money in developing data and tools to see the data. Finland has developed an amazing data system, and they're sharing it with European countries. We're not using them, but if you want the literature on that, I can share it to you, because I really believe it's based on the uses of the city and it's scaling up, and the works it's exemplary.
Great. John.
Thank you. This is a great presentation this morning, and the conversation's been terrific. I'd like to probe a little bit on this question of how of the public finance of the two cities that you represent. It seems a lot of what we've talked about here, it's a question of how do you make investments in these kinds of health programs, and who captures the benefits of it down the road? So I guess one question is, I don't know, and I betray I don't know enough about the system in France and in Portugal, but how much of your revenue is raised through local taxation, through the municipality raises itself, and how much is it flowing from the national government or higher levels of government? And because presumably a lot of the benefits would then flow to other politicians who have to get elected too, right? And so and assuming that a substantial portion does come at the national level, to what extent could partnerships with private companies be helpful to municipalities in advocating at the national or the state level about, frankly, having more resources flow to the kinds of partnerships you're talking about here? It strikes me there's a potential political benefit here for companies partnering with you.
Yeah, if I could just extend that a bit, because we did talk yesterday about the question of the very varying authority of local governments in different countries, different circumstances. So just extend that a little bit, and maybe your network, Charlotte, and likewise Ricardo, whatever. Maybe just comment on that. But I think I don't want to hijack the question, but I think it's a relevant question, and also has to do with how much authority do you have to do what you're doing.
The thing, I think it's, I could tell you in my city is a part of budget. We have national funds and then we have local taxes. Anyway, health is voluntary basis because it's not on the mandate of the city. And still I've got the 1 million budget, which is pretty good as a city because it has co-benefits, because it's good for our shining policy, because people want to come in a healthy city, because it's good for lots of things. So the benefits are also very political, because each time when I'm making a speech with Dr. Tedros and I'm on Twitter with Dr. Tedros, the mayor is proud of that. So it's not only about the money, it's also about the money I'm bringing it with innovation, with, new things. It's something that's really important. But whether we're elected or not, whether we have lots of money or not, when we get together with the healthy cities in Europe, and sometimes, from countries where they just nominated and everything, we have so much in common because it's effective, because we are improving the people's life and you see effect. And this is really good to be elected or to have good outcomes and that each time you have a good outcome, it's good for the others. And I think that the secret of public health is sharing the benefits wherever and it's not, you will not earn money. And we had Sir Michael Marmot on our last national conference. And he says, I don't want economic issues because it's a moral issue. When we see that people poorer are going to live less time, it's a moral issue. It's not an economic issue. And then you can bring people in with economic issue because they can earn money out of it. But I think it's not the point of the public health people. It's something deeper, and it's something on the core value of Alma-Ata and all these things that drove public health. So we can find benefits for the others, and I think that's where, and that's how we get money from the national. I mean, they double our budget in France. In Spain, the national is paying the healthy city a lot because they see the benefit. They see, oh my God, this is good for us. So we have to take them into this commoning power and say, you will earn a lot by helping us.
Cardo?
Well, it's a complex issue, and I agree with many of the points that Charlotte made. In my city, so in Portugal, in general, it can vary. So typically around 70% comes from the national level. But it can go significantly lower, as in my city, because of corporate tax. An important part of corporate tax, if their tax base is in our city, then an important part of that taxation stays in the city. So there is a true incentive to try to attract businesses into putting their headquarters in our city. So that's, of course, and also a trade-off that can be part of the whole conversation. Decentralization has been an important part of our discussions. I feel that many times mayors tend to use the conversation of decentralization and not doing something as an excuse, because when you want to do it, you'll find a way. However, that being said, there are barriers, and most importantly, when decentralization is well done, you see the tremendous impact. So in Portugal, the structural part of schools at the primary level, so it goes up to 4th grade, is run by the cities. 5th grade onwards, so in high schools and whatnot, are built by the central government. So you go to the primary schools, they're amazing, right? They're fantastic, the best in the world. Then you go through primary school and you go into 5th grade, and the ceiling's falling and all those stuffs, right? And you understand that having that local accountability, people knocking at your door, is tremendously powerful. So it is actually in the state's interest to decentralize certain services. We're not talking about, when it comes to healthcare, we're not talking about decentralizing health management or clinical management, but potentially, structural transformation can be decentralized. But that then leads to the financial issues. And the central government likes to decentralize without sending the money, right? And which is also another problem. And so, answering your question, or at least trying to, I think that kind of lobbying at the national level towards making sure that decentralization is well done, and it comes with the appropriate resources, and then create the mechanisms for accountability at that local level, can be tremendously impactful. One last note is, at the local level, cities also have to decentralize to the people. So following actually France's example, we have invested a lot in participatory budgets, where people, actually we've saved 5% of our total budget, and we give it back to the people, and we say, okay, you present the projects you feel you want to develop, and we have a voting system, and it's pretty secure. People do it digitally, text messaging. They can only vote once. And more people vote in this process than they do in the local elections.
Yes.
And that is quite incredible. And so I'll give you one example. So we had this beautiful land, $1 million land by the ocean. And we put it out there and say, you guys present the project you want, we'll pay for it, for whatever project wins. And these kids came together and they developed a skate park, okay? In one of the most expensive neighborhoods in our land. And they won by far. Yep. And the city committed, we promised. And what happened was extraordinary. Not only did it become the most fashionable skate park in the country, it is a source of revenue for that whole area, and it has actually generated a whole sort of social initiatives and movements around it. And so if we trust people a little bit more, we can get amazing outcomes.
Scott, quick question?
Sure, thank you. Those are excellent presentations and great remarks that I think will link into the questions that I'm asking. So I want to thank both of you for the great work and how do we foster more people like you. So I've been in three or four different sectors trying to foster these public-private partnerships for NGOs to big governmental and multinational companies, both in Europe and globally. Last meeting we had Peter Singer on the screen. And he basically said the same thing that I think we've heard here, that the biggest hurdle is ideology. That's the first question, and how do we overcome the ideology so we're able to foster that? And then the second piece, since we have this acronym, I like the evidence-based, data-driven, action-oriented, if I've got this right. Charlotte mentioned a very great piece in her city with health literacy, number one, and then alcohol health literacy, which tied into what Alison Goldberg presented yesterday. And you've sounded like you've had success. So how does, the second question, do we foster the kind of evaluation at the level that it gives the data that, whether it's a city or even the national pieces? It's much easier in the pharmaceutical sector, the pay for performance and outcome-based pricing and other pieces. But when you're dealing with the social determinants and other models, and I guess it sort of links to, can the private company pay for that? This is it. I mean, the end is... But on the data-driven, because we've had data-driven pieces that have gone all the way up to the top in different countries, and when it's paid for by companies, people say that's not evidence-based data-driven, that's company paid for data-driven, even if it's from a second. So that's why I wanted to clarify that.
I think ideology goes in all sides. I mean, when we work with, for instance, private doctors and health professionals, they've got strong beliefs about politicians. And each time I'm making a conference, and I ask who has a good opinion on politicians. So ideology is shared. And ideology, that's why we have to see that sometimes political decisions are not well made, but it's also because sometimes the evidence is not well shared. And sometimes the partnerships are not that good. And so we have to, I mean, ideology is all over. We all have representations. So sometimes just meeting the people is the best thing. And we had the first evaluation of a public policy in my city, and that was my policy. Because I'm not a politician, I was elected in 2014. I come from NGOs and private sector, and I was like, oh my God, nobody evaluate our policy? That doesn't exist. That did not exist, because you don't do that. It's not the cultural thing. And what we show, the outcome was, the best thing we do is we get people to know each other. And once you know each other, it's no more about ideology. It's about, how do we work together? And when we talk about companies and private sector, it's not the same if you, I mean, the problem with a sport person is that lots of sport events are financed by alcohol company. If it's not the same of working with, I don't know, with a pharmaceutical company, a foundation, a tobacco company, oil company. I mean, it's not the same. We cannot just put all the politicians or all the private sector together. It's lots of private sector are now doing the social and the ecological changes, and we have big windows of opportunity there. And saying we share values, we have a frame in which we can work together because we share values, and it's going from ideology to value and share value, and that we can say to the people, okay, I'm doing that, and I'm sharing on Twitter and on Facebook and LinkedIn every day what I do to the people of my city, because I'm accountable, and I'm saying whom I'm meeting and whom I'm not meeting. And if I'm meeting with private sector to say, what am I doing? What's the frame? What I can accept and what I cannot accept. And I think that's where you can change things because you're accountable, and it's not like what sometimes we have, and that's also why we have 99% of young people saying that politicians are corrupted in France, which is absolutely dramatic. But because it's hidden, because it's not transparent, because members of parliament just have dinner paid by whoever. Once you're transparent, when you share why we're doing that, and we're doing that for the people, we're doing that to improve the quality of life of the people, then we can talk. And I think transparency and accountability are the both key to switch up from this ideology perspective.
Ricardo, and then quickly, I'd like Niels and Anne to comment, and Clarion as well, and then we'll wrap up. Okay, so please.
Thank you for that question. From my experience, the more further away you get from local, the stronger ideology gets. Because it's the further away you get from people and the way ideology affects people on the ground, the more easier it is to speak about certain ideologies or others. And it goes all ways. At the city level, what's amazing, I feel, is that people are more concerned about how does this translate into my own life? What does this mean for my kids? What does this mean for my neighborhood? And so picking up what we were discussing before, if we were to reinforce the role of local governance, then there could be a potential to move away from the ideological stance and to go towards what it impacts in the real world, in the real people's lives. As for the data, I personally have been advocating in my own country. Portugal is a 10 million population. It has a national health service. So it's a perfect place to test out a few things. One of the things we've been deciding is if we want to create a financing model towards funding the social determinants and other determinants of health, the CBOMs I was talking about, the community-based outcomes measurements, you need to collect that data, which is tremendously challenging. To do that, you need to invest tremendous amounts of money to collect the data. And so what I've been advocating for is through private-public partnerships, working with the different industries that are interested in also getting data because they want to develop new models, economic models to present their own technologies and tools and solutions. Getting that funding, making sure that the data, since it's sensitive, it is run by the National Health Service. That agency then could collect the data. Through that, we can actually create the financial incentives based on that data. And using technology like blockchain, for example, we can then make sure that people can monitor to the second in real time how their data is being used. And since we need due to European regulation, people need to opt in to give their data in Europe, we can actually, through that blockchain model, create financial incentives through fiscal policy, for example, and through which, if people decide to opt in, they actually get a part of the revenue as if they were shareholders of a corporation, but in terms of data. Because if you think of that data sitting there, today if you want to do a clinical trial in Portugal, it's a nightmare. And the companies know if they step in, they want to do in cancer, and they're looking for these specific patients with these specific characteristics, they don't know where to find them. So they're calling all of the doctors around the country. If you knew exactly where those patients were, you could actually transform Portugal very quickly into a hub for clinical trials, which means millions of euros would start pouring in. And if people could benefit from that and actually see the potential of, well, my data is great because I can actually save lives, as if I were donating blood, but by donating data, I'm actually making money myself and contributing to my health and well-being. So I think that there are tools out there that can contribute to us to move in the direction that we start getting the data that allows us then to build the financial and economic models that create the incentives to do what is morally right.
Next, yeah, you want a quick comment on either Scott's question or just a comment?
Yeah, I think it's very true when you are locally working with the different stakeholders and civil society and the other more of the technicians instead of the politicians. You pass above that ideology. You have to get the approval of the mayor and his office to do the initiatives you want to do, but it is all defined together, and that's the same answer for the data. When you define with the whole group of stakeholders around the table who are the champions and the necessary people involved, and you co-define what your indicators will be that you measure, and you co-define how you will evaluate progress, so it becomes a shared measurement system, and you get shared glory, like you were saying. You have to create benefits that are for everybody visible, and that is how we see that it's successful without having to deal with the ideology, and it remains sustainable, because if the mayor changes, the whole initiative continues.
Nils? Want to make a comment on that?
So there is the issue of trust, and I think so. The pharmaceutical industry has probably a well-deserved bad reputation, and that you are, when you enter the room, often kind of in minus, not in the positive territory when it comes to trust. And I think we've experienced that in many places. First of all, as I addressed before, why on earth are you working in the area of prevention, or is there a quid pro quo? You want to sell more insulin at the end of this, and on some of those factors there. What we found is that not going in with a predefined conclusion or postulate, or you need to do something like that, but saying we would like to work in evidence-based way, carry out novel research, has actually been a way to build trust. Because while you are, research projects typically can take 6 months, 12 months, 18 months. But while you are running that process, and it is actually a safe territory to be in, because you have a third-party local research organization, university to work on that, then you actually can sit in the same room and review progress, and then maybe they're not so bad as we thought, and then you have that opportunity to work, human to human or company to municipality, and actually build that trust. But time is really, really important here. The more local, the easier. And what I think is interesting that there are things that if there was a WHO representative here, I couldn't speak with the person. You have to go through the trade association. That's how it is. It would have to go through IFPMA, and even if we wanted to have a quality discussion about the subject matter. So it just also shows just sometimes how absurd these guidelines and guardrails are. And I understand why they're there, but sometimes, I don't know. Maybe time will address it, patience will address it, and maybe the results that we drive locally can actually prove that maybe there's, as you were saying, Charlotte, that maybe there are different categories, and maybe there are different rules and rules of engagement that will apply to different types of companies, types of organizations, and so on. But we are where we are probably for good reasons.
Clarion?
First, I want to congratulate Charlotte and tell all of you that if you haven't figured it out, she's actually studying for her master's degree, and her finals are the 3rd of July. Okay, and it shows that she's really a good student. I'd also like to, one of the questions I wanted to ask was, what is their legacy? I mean, if you're only in something for 4 years or 3 years in a political position, how do you plan to leave something? Because in the corporate world, when you walk into a room, one of the things I'm looking for, and you solved it when you said systemic. You're approaching it systemically, because I look for the weebies. The weebies are the people in the room who basically say, as you walk in, we be here before you, we be here after you, okay? And these are the people who are going to be there. But if you approach it from a systemic fashion, you get around that. So I applaud both of you, and I also applaud the way to leave a legacy, which you basically stated emphatically, is you never talk about yourself. It's a sort of a selfless discussion about the people you're working with. So again, I applaud you both on that. Thank you.
Thanks very much. I wanted to, this is a point, we went on a little longer because the conversation was so rich, and I really want to thank everyone for your most recent contribution. And I'm not going to as elegantly as Anne, but let's give a hand for our colleagues here, and then I do want to spend a couple minutes just summarizing. So thank you so much for your